All right, this webinar is being recorded so that we can share with folks who are unable to join us today on short notice. So again, this is Monica McLaughlin. I'm with the National Network to End Domestic Violence. I'm joined today by my colleagues Christy Beavis from Collaborative Solutions Incorporated, Larissa Kaufman from the National Alliance for Safe Housing, Ann Menard from the National Resource Center on Domestic Violence, and Miriam Durrani from NNEDV helping with logistics. Thanks so much, Miriam. The objectives of this particular webinar are to introduce you to a new exciting federal collaboration called the Domestic Violence and Housing Technical Assistance Consortium. And we're also going to review the FY16 HUD Continuum of Care Funding NOFA from the domestic violence perspective and offer recommendations. And we're also going to provide you with a number of reminders at the end of the call that will help you continue to stay in the loop, and us as well. So, I will just go back and say the reason, just to expand on one of the objectives for a moment before I dive into the consortium, is that we are responding in a timely manner to the release of the HUD FY16 Continuum of Care Funding NOFA that was released around July 4th. We had heard from the field in FY15 that a number of programs have been defunded. So from this process, and so we were working on FY16, and but the NOFA dropped quickly, so we wanted to get on the phone with the field and help you navigate this process this time around so that the losses weren't quite as significant. That's really why we're here so fast and why we appreciate everybody being on the phone call. We're going to go through the Domestic Violence Housing Consortium, but while we're doing that, if you want to multitask, it might be a good idea to go back to the original email that we sent and print out our recommendations. There's a 7-page recommendations that we put together, and we also in our link had the HUD funding NOFA. If you don't have the two pieces in front of you, it would be a good idea to take some notes on page numbers, because then you can go back and help be a better advocate in your community, because you'll remember where we were talking about. It's a really sort of technical process here. So I think it's a good idea to either take notes or print out the recommendations and follow along at home. All right, so let me dive into the Domestic Violence and Housing Technical Assistance Consortium. 4 federal partners came together, 4 federal agencies came together, having heard about the issues of the intersection of domestic violence and housing and homelessness, and just hearing a lot from local programs and others that there are lots of challenges in terms of providing housing for survivors. And so the 4 federal partners came together, which are the Family Violence and Prevention and Services Program at the U.S. Department of Health and Human Services, the Office on Violence Against Women at Department of Justice, and also the Office of Victims of Crime at DOJ. Additionally, they were joined by the Office of Special Needs Assistance, which is called the SNAP at HUD. So it's a unique partnership for the coming together like this across the federal agencies, and they chose to fund a number of organizations that are all on the call with you today, and you'll learn a little bit of them. The District Alliance for Safe Housing DASH, or also known National Alliance for Safe Housing, Collaborative Solutions, Inc., or CSI, NNEDV, and the National Resource Center on Domestic Violence. So we're all working in collaboration, and all of our work towards providing technical assistance and training to the field is collaborative, and we're really working towards a strategic plan of making sure that our technical assistance is reaching the field, and we're doing some really exciting work. And so I'm going to dive into what NNEDV is doing in particular, and then I'll hand it over to some colleagues. So many of you know us. NNEDV is a social change organization, and we're dedicated to creating a social, political, and economic environment in which violence against women no longer exists. We specifically care about housing for lots of those reasons, safety and economic reasons for sure. We also have other projects that kind of complement our work on this issue as well. in terms of our specific housing project, we do a lot of work with the OVW, Office on Violence Against Women Transitional Housing Grantees, which I think many of you are, and we are the sort of technical assistance comprehensive provider, and then we also do collaboration and systems advocacy, and we call that project the Collaborative Approach to Housing for Survivors, and that's the project that is funded through the consortium. And we have some key partners, the Confidentiality Institute, Iowa Coalition Against Domestic Violence, and the Kentucky Coalition Against Domestic Violence, as well as other partners on the phone today. And our focus areas, we really provide a lot of in-depth technical assistance, training, and resource development, specifically at HMIS, coordinated and funding issues. In terms of HMIS, we've been tasked with researching and gathering information on HMIS systems and comparable data that are used by the fields, and we're meant to develop a strategic plan to address the significant issues. We're partnering with collaborative solutions on a lot of those pieces and the National Resource Center on Domestic Violence. We are providing input and subject matter expertise about HUD regulations, so that's why you're on this phone call today, at the intersection of other relevant laws on domestic violence programs and survivors. So funding streams, of course, fall into that. And we do a lot of coordination with the field and hear from our coalitions and their local programs, and then communicate back out to the field. Okay, so this is my contact information. Feel free to contact me with more details about your community if I haven't heard from you already. Any questions that you have on those technical assistance areas or others, I can connect you. With other TA providers as well. I'm seeing feedback that I have to louder. Okay, I'm going to pass it over to Larissa.
Hi there, this is Larissa Kaufman. I'm the Director of the National Alliance for Safe Housing. Welcome everyone to this webinar. The National Alliance for Safe Housing is a project of the District Alliance for Safe Housing. So you might have heard of DASH before. DASH is a local safe housing program in the District of Columbia. The National Alliance for Safe Housing, also known as NASH, is a brand new national technical assistance and training project. We actually were launched in last October 2015. We provide technical assistance to the domestic violence and sexual assault fields as well as the homeless and housing fields. We are an OVW TA provider. We have 3 partners for NASH, the Washington State Coalition Against Domestic Violence, the DC Coalition Against Domestic Violence, and Chris Gohart, who is formerly with Volunteers of America Home Free in Portland, Oregon. So as I mentioned, we provide technical assistance to communities around the country, focusing on tools, strategies, and providing support to really improve the coordination between domestic violence and sexual violence services, service providers, and homeless and housing providers. We work with programs as well as with systems within jurisdictions. So a couple of examples of the technical assistance that we provide, not limited to this list, but I thought I would just give a couple of highlights, include coordinated entry, building collaborative relationships and partnerships between the systems, trauma-informed practices, rapid rehousing, housing first, flexible funds, also known as flexible spending, implementing federal, state, and local housing protections at the state and local level. Something that I want to highlight that we've been focusing on since we launched in October is actually something that we're calling the Safe Housing Needs Assessment. This is an assessment, really the first of its kind in terms of sort of the breadth in terms of what we're trying to gather from the fields. We are looking at a range of different areas, including relationships and partnerships that may exist in your communities, between the systems and the different programs, training that your training needs and TA needs, training that may be already provided or that you're receiving on these different issues, funding, whether you have coordinated entry system, what that may look like, what you may need support with, just a range of different areas. And we actually are going to be reaching out to all of you. The needs assessment is has already been developed. We're waiting for the approval to go ahead and disseminate it, which hopefully will be in the next couple of months. And NNEDV is going to be helping with that process in terms of dissemination. So you'll probably see it in a range of different listservs. So we're going to be asking for state coalitions and also local programs to take that needs assessment. We're really excited about launching it because we think it's going to give us some really important information that we haven't necessarily received before. We're also going to be sending it to homeless coalitions as well as homeless and housing service providers. My contact information is right there for you. If you're interested in, if you have a TA or training request, you can email the NASH info box, or you can contact me directly. My information is right there for you. Thank you all so much, and I believe that our next partner who's going to speak is going to be Anne with the National Resource Center on Domestic Violence.
Welcome, Anne. I'm not sure if you're off mute yet. We may need to just wait a second. Is that you, Anne? Are you there? Oh, okay. We might want to work on Anne's technical side of things. I'm so sorry. And then maybe we'll skip to Christy and come back, if that works for folks. Just waiting for a signal. Sorry about that. Oh, Anna's saying just do her slides. Okay, I can do that. Well, Anne Menard is amazing. I'm sorry that we're not giving you a voice today. Many of you know the National Resource Center on Domestic Violence is an absolute treasured resource in the domestic violence community. They're, as part of a broader social change movement to end gender-based violence, NRCDV strengthens and transforms efforts to end domestic violence. The NRCDV has a number of housing project partners, including the Michigan State University Research Consortium on Gender-Based Violence, the National Indigenous Women's Resource Center, Asian Pacific Institute on Gender-Based Violence, Institute on Domestic Violence in the African American Community, Casa de Esperanza, which is the National Latina Network for Healthy Families and Communities, the LGBTQ TA Learning Center, Minnesota, Washington, and D.C. State Domestic Violence Coalitions, us at NNEDV, and the National Housing Law Project. And their key focus areas, along with DASH or NASH, is the safehousingpartnerships.org, our website for our consortium. And so we're really excited about that launch relatively soon. And contact information. All right. Thanks, and I think we're going to hand it over to Christy. I'm going to wait about 30 seconds and see if Christy can join us, and if not, sorry about all the technical stuff. You guys, this is a real shame because Christy has the most wonderful accent, and I won't do an imitation of it, even though I'm tempted. So I think I will go through hers. I'm so sorry, Christy. And again, such a shame. Hopefully you get to hear from her at some point. Collaborative Solutions, Inc., so their mission is that they work in partnership for the empowerment of human service organizations and communities in order to positively impact special needs populations. they provide comprehensive community development, so that's through technical assistance and training, community initiatives, research, planning and policy, and statewide and national advocacy. They focus on HIV and AIDS, housing and health, homelessness and HMIS, affordable and rural housing. And so within those buckets, they have a number of other pieces. Just because I get to have the floor, I'll just say that it's been a pleasure working with Collaborative Solutions on everything related to HUD, because they have, they sort of speak HUD naturally, and so they've been helpful to the domestic violence community as we all ramp up our capacity. So that's been a really useful part of the DV and Housing Technical Assistance Collaborative, to have a multiple set of partners who are funded. And Christy can be reached at this email address. And then you can call her and hear her accent directly. So, okay, sorry about all the technical stuff. Thanks, everybody. Okay, so again, just diving into the history and background, the FY16 fiscal year, federal fiscal year 15, Notice of Funding Availability, the NOFA, we saw within the NOFA that there were a number of opportunities for domestic violence community. For the first time, domestic violence had really been elevated as a issue that communities needed to focus on, and so we were hopeful that there would be increased attention to domestic violence across the continuum of care funding process. And I think everybody on this call is familiar with the continuum of care funding. It's funded via the HUD SNAPS office, authorized by the HEARTH Act, or also McKinney-Vento funding. And it goes to your communities, and the way that it's distributed is via this application with the continuum of care that are sit together over the year to sort of coordinate their homelessness systems. So lots of these issues are coming from, the HEARTH Act focus on increased collaborations, and that the funding be given out in a way that is strategic and accountable and based on performance. So that's kind of the why does it happen like this. And so we were hopeful, and then we noticed that in Tier 1 and in Tier 2 that there were, particularly in Tier 2, that lots of domestic violence programs had been placed in Tier 2, specifically domestic violence transitional housing programs, had been placed in Tier 2 and had lost funding because of that. And so that started to be clear in about I'd say early May, and so we sprang into action and petitioned HUD and others at the federal level to amend the NOFA for FY16 to make it more responsive to the needs of violence survivors. Due to timing and other things like that, our recommendations came into HUD, but HUD, it sounds like, already had the NOFA mostly written, and the ink was dry, as we say, and so there was not an opportunity to amend it at that point. So that was unfortunate, because looking at the FY16 NOFA, there were a number of, we believe, we would say and assert that there were missed opportunities. And when I say me, I'm talking specifically from NNEDV's perspective, but joined by lots of advocates as well. We see a lot of missed opportunities that still kind of enshrine the challenges that were in the FY15 NOFA and have been problematic since the passage of the HEARTH Act, and the ways in which it doesn't sort of respond to the specific design of domestic violence programs. So we worked with, we're currently working with the White House and U.S. Interagency Council on Homelessness, others at the federal level, to make sure that anything that can be done for the FY16 process is done now, right? So that's why we're on this call today, and we've put together the recommendations, and we're here for communities for additional perspectives. So that's why we're sort of moving into action and just really putting everything that we can into helping programs be competitive for the FY16 NOFA. Because from our perspective, we know HUD is trying to move towards different types of housing models, and there are certainly value to all sorts of housing models. We and an ADV certainly doesn't sort of pit one model against the other, and that's a particular situation. I think at the moment there's some of that happening, and so we would like to see all types of housing programs funded, and really have concerns about domestic violence programs losing funding, because in many communities they're the only place in town, and without that domestic violence capacity in a community, you have less capacity to really understand the needs of survivors and to serve the needs of survivors. So that's really our reason for advocacy. In terms of future advocacy, we do, tomorrow there's a webinar by the U.S. Interagency Council on Homelessness. They will be highlighting this. So it's important, this is a note. If you're going to take notes, I would take this note. Try to get your continuum of care folks onto that call, because they're going to hear things tomorrow about domestic violence. So maybe you don't have to be on the call. That's why you're on today, but get your community on the call. Okay, so that's your first please do action step. And that is in the materials that we've sent to you, and will be also at the bottom of this PowerPoint. In terms of future advocacy, we are looking to continue to involve the federal partners, and making sure that everybody can, that all attention is on this issue as we try to make things better for the FY17 NOFA, so in the future. So for programs that were defunded, completely defunded in FY16, there's no clear avenue to reapply as a domestic violence transitional housing program. That's probably the biggest disappointment for us, and disappointment is probably the light side of the scale. We're really upset about that. We've tried every which way to get that to be changed, and it doesn't seem like it can be changed on this time frame for FY16. Domestic violence programs can apply as new rapid rehousing or permanent supportive housing, and some folks have definitely done that. And we can help, if you haven't already connected, and HUD is working on trying to increase connections with their field offices to have funded programs connect funding streams. One is called HOME, CBG, the Emergency Solutions Grant, and other victim services funds, and we hope to have some more information about that and send that out to you. So I'm so sorry, for the programs that were defunded, that's sort of the advice, is either you have to be out for this round, or you have to reallocate to another type of, or you have to reapply as a new program, for rapid rehousing or permanent supportive housing. If you want the COC funds. So that's unfortunate but true. For programs that were funded in FY16, you've already started to hear from your communities, it seems like. 82% of you are concerned that you're going to lose funding in FY16 or could lose funding. So we say advocate strongly for access to funds. You still have a chance. We plainly say fight your way into Tier 1 and push back on pressures at your continuum, and report any challenges that you have to your state coalition and to NNADV. So look, the NOFA is what it is, and it's got some good stuff in it and the bad stuff in it, and I think, but what you can find if you're really digging into it is that it doesn't necessarily have mandates. It doesn't say you have to get rid of your transitional housing. There's just a lot of pressures. There's a number of pressures within the NOFA that sort of lead a lot of communities down the same path, even though that's not explicit in black and white. And because it's not, we think there's still an ability to push back. But you'll have to push back fast. So, we think that because it's not a mandate, as I said before, you can fight to stay in Tier 1. You can resist reallocation if you want, if you've got sort of building-based transitional housing and the transition doesn't really work for you. And you can push back on over-interpretations of HUD's NOFA. So folks might say, well, HUD says we can't have this or that. Lots of the things that community says might not be totally true, and so you can push back on that after you learn about them in our webinar. So here's another opportunity. This is another opportunity that your communities might have missed because it's sort of buried at the bottom of an email, okay? But I want to make sure this is in your recommendations that we've sent you and is here on this slide, that, we want to make sure that you see is that HUD, says that when continuums of care are looking at their ranking decisions, that they need to consider the special populations. And they've received a lot of questions about domestic violence transitional housing. Thank you all for that. And that HUD recognizes that DV programs are valuable, especially when there's no other place in town. They want the COCs to review and rank those projects with special attention to the needs of the population in mind, and make sure that the programs are not unfairly disadvantaged. I think that's really strong. It's not in the NOFA itself, but it's in the email. But then there's a caveat that says basically you still have to make sure that those programs are effective. And from our perspective, the challenge there is that the performance measures haven't really changed, and that can be challenging for domestic violence programs. So I think I've said a number of these. So this is a good point to take to write down. So domestic violence transitional housing programs and other domestic violence programs should really connect addressing domestic violence to the priority area in the NOFA of ending family and child homelessness. Because if you work on domestic violence, you might know, hey, this is related to child and family homelessness, or child and family homelessness is actually related to domestic violence. So make those points clear and strongly in your communities to make sure that they are addressing domestic violence. DV programs can be in Tier 1. I'm going to say that a lot because I don't think people know that. And HUD has instructed communities to review domestic violence transitional housing with the needs of survivors in mind. Your application, the continuum of care application, can actually account for the unique design of domestic violence transitional housing. It's just that folks haven't really done that yet, but they can. Reallocation is not required, although we know that domestic violence transitional housing will seem like the low-hanging fruit, and there's lots of pressures for reallocation. It's not required. Another key point that HUD did make in the NOFA is that transitional housing programs can be considered housing first and low barrier and should be presented as such. And look, if you're an OVW transitional housing program, we work really hard with those grantees to make sure that they're low barrier. And so make sure that all that work that you've done to be low barrier and move towards housing first, that you present that to your community. And anytime your community would defund a domestic violence transitional housing program, even though for you that might be your program and that might be very stressful, and we totally understand that, it's also important to advocate that that money go to another project that is directly serving domestic violence survivors. It's a myth that HUD wants communities to get rid of all transitional housing. I mean, they definitely have a preference. They're moving away from funding new projects like that, but you know, there's still some consideration for domestic violence transitional housing. And it's also a myth that domestic violence transitional housing has to be in Tier 2 or reallocated. Those are both not true, but again, there's lots of pressures. So again, I'm just reiterating these points that are in the recommendations, that you can be housing first, low barrier. You can help your community end homelessness among households with children. That's a really valuable role you can play. You can be evaluated according to domestic violence specific metrics, and you can be placed in Tier 1. So how do you help your community understand that you are housing first? I mean, that basically that maybe transitional housing you have to do more than one move, and your folks have to stay longer sometimes because of their own specific situations. But the way to make sure your community knows you're housing first is to explain that it's not that the program is putting a housing barrier up for the survivor, but that it's the material reality that the survivor has and her own or his determination about when that person is ready to move to their permanent place. So I think it's really important to be able to convey that to your folks. And if you have any more questions about how to really look, you know, how to portray yourself as housing first, let me know. And we can help you. So one of the places to really pay attention to in the NOFA, so again, just get that NOFA out, going to pages 9 to 10, looking at that Housing First section, and explaining what I was just saying about how your programs can be housing first. And then you can also talk about how domestic violence housing first, or domestic violence transitional housing meets the goals of removing barriers to entry and adopting client-centered models. I mean, domestic violence programs are very client-centered, so you should be able to help your community meet its goals outlined in those sections on page 10 of the NOFA. Highlight your voluntary services, that you have limited program rules, and that you have low barrier admissions. Those are all valuable things in the HUD funding NOFA. But explain as well that your community, you know, that, look, domestic violence transitional housing from OVW has to offer at least 6 months. So even though you have to offer that, you don't always offer it. You know, it doesn't always go that way, but that you can have still have rapid placement in housing. So I would just remember to reiterate that. And then talk about what are the reasons why, and your community should really be looking at, what are the reasons why survivors might stay longer? Establishing safety in the community, the survivor's economic means, resolving trauma, custody, divorce, immigration, all those reasons why survivors stay longer. Okay, here's another really important piece that only you, and I'm pointing at the computer screen and the, you know, number of the 110 folks that are on the call, only you can ensure that your community meets the needs of fleeing domestic violence victims. Like that your communities need you to be able to get maximum points on this section, which is points, and that doesn't seem like a lot, but it does matter. Every point matters. And you know, I think if your communities are defunding your programs but still saying they're putting a priority on domestic violence, well, I would question that. You know, push back on that. This is a place where really a community should not be able to get the points unless the domestic violence programs are really at the table and making the cases. Another place to take a note. Okay, this is the biggie. This is a challenging one about, and someone asked this earlier about performance measures, and I haven't been able to follow the chat because I'm talking. But look, evaluating domestic violence transitional housing has been a challenge, I think for a number of reasons. One, we know that it's challenging to collect the data and share the data in a way that your community can accept, right? Because lots of the data on performances is taken from HMIS. But that's not the only place. Your community also has to describe what it's doing to evaluate its programs. It has to describe how it's ranking and reviewing specific programs. So there's still an opportunity to make the case that domestic violence transitional housing should be evaluated on criteria that reflects their specific design. From our perspective, domestic violence community should be able, the community should be able to mitigate the places where domestic violence programs might not compete as well. We want to make sure that you know, your community has the opportunity to say, hey, look, our domestic violence programs didn't do as well on X, Y, or Z metric, but we think it's because X, Y, Z reason, and we still think they're valuable and want to keep them. And we're working towards a way to make this all better, right? So there's a way of describing the narrative, the objective process, so that domestic violence performance measures can, we think, be looked at. So, so that's one of the things that we're really concerned about, and we want to make sure that communities have some ways to address this. So we want your continuum to consider additional outcome measures. This is one thing that might be challenging in this late stage, and it's sort of the timing is just not been in our favor, but we still think there might be an opportunity for you to urge your continuum to basically take the metrics that you collect about your program on the things that you think are important for survivors, and share those in your community to have your community evaluate you. So some of those are the ones that are collected by the Office on Violence Against Women, which are survivor destination upon exit and perceived risk of violence. So some of you might have those, and you could share those with your continuum. And increased client knowledge of community resources and ways to plan for safety. Because those are empirically connected to long-term safety and well-being, and lots of programs that are HHS funded collect that data anyway. And any other data that your program has to demonstrate effectiveness, we think you should be sharing with your continuum and pushing to have them develop a process by which to do that. And then, like I said, continuum should really, you know, explain and mitigate what are the different factors that might make domestic violence transitional housing programs not look as competitive. Make the case for location of why they're still putting the DV program in Tier 1, and really push for your community to try to at least explore that option. So in particular, we're telling the community to pay attention to pages 38 through 40, Section 5, system performance. So we've listed why we think that some of these sort of specific metrics that are measured might be challenging for domestic violence programs, and what you can say that helps your community understand that they can still kind of see the domestic violence value here. So you all might not be as good at reducing the number of homeless individuals and families, because while participants are in your program, they're considered homeless. That's just their sort of status according to HUD regulation. You might not look as good on length of time homeless, right, because folks stay longer in terms of getting to their permanent home. You might not always get people into their permanent house or prevent retentions to homeless because of safety, right? You might get someone moving from your program to another because they've had to flee your program after the perpetrator has sabotaged them. And then they might also return to homelessness after their perpetrator has found them in the community, right? There's a number of reasons, so you can explain that. And then request that your continuum of care allow programs to demonstrate that in some instances, in subsection F, this is about income, that some survivors might not increase their income based on a number of reasons, but that the program is designed to build a survivor's economic base. Lots of you could be competitive on that because you work with economic justice curriculum and you have lots of different pieces that help survivors towards the goal of increasing their economic base. So I wanted to, remind your community that, your issues are systematic, way beyond your control because of HMIS issues, and that data sharing is particularly complicated. So the fact that, you do enter the data, but your community doesn't take it from you in terms of doing performance sometimes, depends on the communities. Folks have worked out different ways, but that lack of clarity from the federal level has really left domestic violence programs vulnerable, and we think that is not fair. And we're working on that. We are really working on that as soon as this little crisis resolves. But we want you to remind your communities that the reason why they don't have as much data from you is sort of beyond your control. And again, another place you can get your community focus is to look at the objective criteria and past performance, where they have to fill in that section on page 36. They can really outline what their criteria is to really elevate the work of domestic violence programs. They don't have to ignore your specific program design. In fact, they could make a case in this section for why domestic violence is ranked differently and why past performance is sort of understood in a more favorable light. And again, this is the same point I've been making, but this is the specific section you can look to and help your community see that in the ranking and selection process that they can make they can clarify in writing why they decided to put the domestic violence programs higher than they might objectively look because of all the mitigating factors. So again, just look at those specific pages and help your community see how they can make a change. And as I said earlier, the strategic planning section in the NOFA is very important. And one of the strategic areas and policy priorities is ending child and family homelessness. And as you know, the vast majority of folks who are facing homelessness as women and as children are victims of domestic violence. So your community cannot resolve this issue without addressing domestic violence. And I think, it's local advocacy that helps make that clear. So I think that's one thing that you should make sure that your community, when they're looking at writing that section of the NOFA, that they know that domestic violence is a key issue facing children and families who are homeless. One of the other big issues that you're all going to be facing is the pressure to reallocate, right? So this is hard. I mean, I think it's baked into the NOFA that communities are going to want to reallocate. There's incentives to do that. There's pressure to do that. But I think just flat out explaining that DV doesn't have to be reallocated is a good reminder. And then one other thing that occurred to us is saying, hey, look, we know that you want to compare the cost of domestic violence transitional housing to other funding, but maybe it's better to compare the cost of domestic violence transitional housing to permanent supportive housing, because really it mirrors that program in some ways as well. Permanent supportive housing is for folks whose vulnerability issues may not resolve in time, but it is a more intensive process, and so we think that that does mirror transitional housing in some ways better than rapid rehousing. So we thought we'd throw that out there for you to make that case. And then in the case that your community does reallocate, and this is more geared towards the state coalition folks because it's harder as a local program to push for this, but if they are going to reallocate as a continuum, that reallocation should happen and go to projects that are really serving people fleeing domestic violence, not in an ancillary way, but in a a conscious way that is specifically targeted to victims of domestic violence. And so make sure that any reallocation means that you're maintaining the resources for domestic violence survivors, and that those go to victim service providers, in our opinion, folks that really get it and who are going to prioritize victims of domestic violence. And then, one of the issues is that a lot of folks face when they're doing reallocation are some bureaucratic things where they have to wind down their one funding stream to get the other, to get the new grant contract executed, and that can create a safety issue for the survivors who are in the programs. So your field office is really in charge of that, so being able to communicate that losing funding for any X amount of time is dangerous for survivors, I think that will help expedite the process, and we're trying to get the federal folks to see that as well. And then, if you are going to move to rapid rehousing, I think push back on community-led benchmarks on the length of rapid rehousing subsidy because, as we know, domestic violence survivors often need longer for those pieces as their life is sort of rebuilt. So again, put that together for your community. We just had like 3 other considerations. So in coordinated entry, your COC is supposed to think about people with the most extensive needs, and you could really make sure that they're really thinking about folks who are fleeing for their lives at some time. So you want to make sure that they understand DV can be one of those, the most extensive needs. There is a 10%, in some communities might apply for 10% of funds that address family homelessness, unstably housed families, and that might be able to go to domestic violence organizations if for some reason they're serving folks who don't meet the fleeing domestic violence. It's kind of complicated, I think, but you might be able to leverage that 10%. And that one of the other pieces is that domestic violence transitional housing participants can come from either the street or from shelter in order to be considered homeless. This is just a technical piece on page 25, so just help your communities understand that. And just a couple of reminders, tell us about your experiences. You can email me and we're keeping track of what's happening in the field. Join the U.S. Interagency Council webinar tomorrow, but also communicate that to your COC partners so that they get to hear the messaging around domestic violence. And when the needs assessment comes out, please do complete it and submit it so that we can have a better sense of where domestic violence program needs are, and we can tailor our training and technical assistance around those issues. So I know we did blast through. It's a lot to cover. I would recommend, again, you've heard it. Now take the recommendations that we put together, look at the NOFA together, and devise an advocacy strategy for yourself at the local level. And feel free to check in with us as you're devising that strategy as well. So the question portion, we haven't allowed you to verbalize your questions out loud just in the chat, just to maintain the order of the webinar. But we can go through a few of the questions here and see if we can get to some of the answers. And I don't know if our oh, there we go. Okay. Larissa, why don't you try to talk and see if you're unmuted? Yes, there you are. Hi.
Hi.
If you have any of the, hi.
All right.
If you want to say any of the answers, yeah, go ahead.
Okay. I've been tracking the question, so why don't I pose the question and then we'll see, you can field them or we can field them, whatever makes the most sense. So the first one is actually just a logistics question. It's an important one, which is, will slides be available? And also, will we get a copy of the chat discussion?
The answer to those questions are yes and yes. I can certainly collect. The slides they're pre-populated with the recording, so it'll be everyone speaking over the slides. And then I can also send a copy of the chat to everyone who is registered for the webinar and then send them out to listservs to be forwarded as well.
Okay, question 2. How many domestic violence transitional housing programs lost funding in FY16?
Larissa?
Can
you hear me?
Christy, we can hear you.
So, Monica, what were you going to say?
No.
And then I'll provide additional.
No, you go ahead. You go ahead, Christy.
That is a good question, and I think we're still trying to determine that, an official number, but I will say that unofficially I was trying to do, trying to do a little math and figuring, which, I don't want to say this is 100%, but we're looking at probably around 100 agencies or projects that lost funding. But the thing with that, to say is some of those projects could have been under reallocation, so I don't want to land solidly to say that it's 100 exact, but again, I think, it's a significant number.
Okay, next question. The message we are receiving is that funding for transitional housing is going away.
Yes, hi, and I did see that. That was from Elizabeth. Hi, Elizabeth. So, sure. I mean, I think in terms of where HUD is prioritizing is, of course, rapid rehousing and permanent supportive housing. And I think that, our advocacy over the last bit has helped HUD see why the preservation of some transitional housing is important, even in their push to move away from it. I mean, I think for HUD, it's about serving the most people with the smallest intervention, and that the intervention that it will take to have the person not come back into the system. So there's an efficiency perspective, and I think that that's really what HUD's perspective is. And so that I think is important to know, and then to also be able to say, yes, asterisk, we're different, and here's why. And I think that there are lots of things that domestic violence community can do, and it will be challenging in this year for sure. And we're hopeful that FY17 will do a better job of valuing transitional housing. But that your community has gotten that message is not, there's sort of explicit messages, and then there's messages built into incentives and other pieces. So we see why people think that. Certainly, those two other housing programs are prioritized, but we think there's still a fighting chance for some transitional housing.
Right. I just want to add one more thing. This is Larissa before we go to the next question. I also just want to add to what Monica said that many of the, obviously, domestic violence transitional housing programs have elements of housing first. And some of you also have some of the approaches that are also part of rapid rehousing models. And so there are ways to be able to capture that are included in the prioritization for the NOFA. And I think that determining how best to capture that and to really make that point clear at the community and local level is really important. I think there's been some gaps there in terms of how that can translate into continued funding. So I just wanted to add that piece too, because I think it's important.
So,
Christy,
Larissa,
did you want to add something?
Add one more thing?
Yes.
Okay. So the other thing I would say is I know there is huge concern over future of transitional housing, and especially what we saw with the 2015 NOFA and how some of the continuums, it felt very much like a kind of a wholesale reallocation. But I think that there's been a big disconnect, and I think it's going to behoove the DV consortium team along with our funders, to figure out how do we maximize this opportunity to ensure COCs and the projects being funded understand that transitional housing for survivors of DV, substance abuse, and youth, age, and adult foster care remain a vital part of what the solution is. So, you know, again, I think it really falls on us to figure out how we carry that message out and how everybody gets on the same page and understand it, because there is a disconnect between what messaging has been at a federal level and how it gets translated into the communities. And I know that's not an easy answer for people on the call when you're looking at, you know, facing the real funding cuts, but that is a piece of that's vital, and it's got to happen.
Thanks, Christy. Okay, so the next question is, what are NNEDV and NRCDV doing around social and media surrounding this issue? If you are doing something, what specific solutions are you advocating for? Are they at the HUD level or COC community level? And I think, you know, since we're still having some technical difficulties with audio for Anne, that might be something that Anne can also possibly respond to within the chat so that folks can see the response there. I don't know, Monica, if you want to kick it off.
Yeah, hi, this is Monica. Quick question. I think we did hear from other folks at your organization about this question, and we are kind of contemplating it internally as well, because there were a number of media hits on the issue when the NOFA, when the Tier 2 decisions first happened, and I think that that was a good place for folks to get attention. I think that we're still contemplating what would make the most sense in terms of being able to leverage media on this specific issue. So I don't have a great answer yet, but and it's on our list of things to noodle over. But if you all kind of have a vision, then I would be happy to talk to you and your shop about that, because I think we would be really happy to hear that. I mean, we do have, I shared in the notice that we sent out, you know, that we've had a lot of congressional attention and that a number of offices are holding briefings with leadership at HUD, including the HUD secretary. So this is certainly a congressionally an issue that Congress is paying attention to, and everybody, you know, as citizens of this country have, the right to make sure their members of Congress are in the loop on issues that impact constituents. So I think those are other things that folks can be thinking about as well. But I'm going to follow back up with you, Krista.
Okay, I'm going to go ahead and keep going, but we'll check out the chat to see if Anna's going in there to respond, which I think she is in a second. We're all multitasking, a lot of amazing questions coming in from all of you. All right, so the next question is, if we use HUD funding for permanent supportive housing and not for transitional housing, will these cuts also affect permanent supportive housing? Interesting question.
So, everyone, this is Christy. I don't know if I need to identify myself since Monica says I have an accent. But anyway, I would say a large part of this conversation, has been geared around strategies for transitional housing. But we want to ensure everyone on this call has the tools and resources to ensure continued funding and maximize your partnerships with the COCs. So while COCs have been prioritizing housing for those that have the highest degree of vulnerability, which would definitely be people going into permanent supportive housing. I don't want to just give a blanket statement and say that you don't need to be concerned. I think, having those conversations with the local COC to make sure you're aligned with what they're doing, and also if there's whatever the process they're using for reviewing projects, you want to have that information and make sure, because information is a great tool to have and to safeguard against loss of any funding, if that roundabout answer makes any sense at all. So just because you're a PSH, I don't want to say you're 100% safe. I think you've still got to be having that relationship with the CSC and making sure you are in line with how what they are saying about how they're ranking. And I think another way to do that is if the people who are on the call today, if you haven't been actively involved in the COC, it's not just about the funding application. There are certainly, with the COC governance, a great need for having representation from the DV community to help shape policy and planning, and also to help in determining how funding decisions are made every year. So I'm going to give the plug out for the integration of DV into COCs with that answer.
Okay, next question. We are receiving a lot of pressure to use a database that is comparable to HMIS. How can you help us with this? Does everyone else have a comparable database? How does it work for your DV agency as a whole, not just for transitional housing?
Yeah, this is the billion-dollar question. This is Monica. So we are working on some solutions to this. I think we can do some individualized TA. So, you all have my email address from the PowerPoint that you'll get, and I think through the email that we sent as well. We can talk to you about specific, you do have to have a comparable database if you're accessing HUD funds. And the comparable database, as of right now, has to have all this, it has to essentially be as bells and whistly as HMIS in terms of the same data, the data fields, and be able to do the same reports. So that's challenging for domestic violence programs because the program has to be in-house, and so there's a lot that is challenging. But absolutely, everybody does have to have a comparable database. That's the reg. We're hoping that we're going to see regulations that clarify some things on comparable databases that would that would help alleviate some of that pressure. And so, but we don't know for sure. So yeah, I would say. You definitely email us individually on the HMIS stuff, and we're hoping to have some system-wide changes in the future.
Just one quick thing to add to that, too. This is Larissa. I just want to add that as part of the Safe Housing Needs Assessment, we are trying to determine how many jurisdictions or how many organizations are actually using a comparable database, what's working, what's not, and how that looks. And so that piece of information is going to be extremely helpful because at this point a lot of it has been anecdotal or from sort of a handful of jurisdictions that are doing it. So I just want to add an additional plug there for the needs assessment because it'll really help us get a sense of what's actually out there around the country. Okay, next question. Our COC has said that our community needs to make more progress serving chronically homeless individuals. Sorry, I'm scrolling down. Before addressing family homelessness, is there a way we can respond to this?
Hey, Larissa, I'm typing as you're talking about that. Hold on one second. I'm sorry, not that. So is that the question from Christina?
Looks like it might be.
An answer. And so this is what, Christina, I would say is, I know there was a big push and priority to end chronic homelessness by the end of 2016. And so I know that has received a lot of attention in the COCs. But as you know, USICH and HUD are prioritizing ending family homelessness as well. So I think that it's important for COCs and communities to address both concurrently. Not every program is set up to be able to address chronic homelessness, and other programs are geared more towards addressing family homelessness, so I think there's opportunity to do both. And I think it's just trying to figure out the strategy for doing that because, I know coming from a community, that's where we really struggle too, but I think there's opportunity to do both, and you've just got to be having those conversations with the COC and as a membership and planning how that happens. Because again, not every program is suited to address every type of homelessness, nor should they. I think it's figuring out the niche and the strategy and how you align in the overarching continuum of services that are being delivered. And then Christina, I also posted to ask where your program is located, so if you don't mind chatting back and giving us that answer, because again, I think it's important for us when we're looking at where these issues are popping up and emerging, that we have a sense of like the location as well, so we can start strategically addressing.
Right. I just want to add one other thing before we go to the next question. In addition to what Christy said, I think it's really important, as we all know, in the domestic violence field, we understand the link between domestic violence, family homelessness. We see it as coinciding as, one in the whole. The messaging around that on the local level really needs to be tight and clear. Domestic violence is obviously connected to family homelessness. They are intertwined. They are, domestic violence is a cause of family homelessness. That messaging is really, really important in any of the efforts you do, whether it is, for funding or for other advocacy. I think linking those two is extremely important, especially as there's more national attention to family homelessness. Okay, next question. All right. Should we contact our federal members of Congress at this time?
Hi, guys. This is Monica. So this webinar is funded by our federal partners. It's not really an advocacy webinar. I think, as I stated earlier, as citizens and residents of the country, you have, of course, the right to be in touch with your federal legislators to let them know what's happening in their constituencies. And so, on a non-federally funded call, I will make sure that that's communicated to you via your federal advocacy partner here in DC and NEDV. So, watch the space for that.
Okay, next question.
Hey, Larissa, can I add one more thing? I'm sorry, I was reading through comments.
Yes.
I know I'm lag time. The other thing I think is important, and I don't know, if y'all are facing issues and it's been where, the COC is saying, giving funding, ranking decisions now, if you haven't been reaching out to HUD through the AAQ, I think it's important to do that and let them and start. It's important for us to assimilate this information and share it, but I also think it's important for them to have specific incidents from the communities and the projects who are facing this, because we can go back and make the case, but it sure does help underscore what we're trying to do when they're hearing from the communities directly, and I think the AAQ portal is a way to do that. Because you're not only going to be able, AAQ is Ask a Question. Thank you, Karen Sellers, for asking me what that was. But it's on the HUD Exchange website, and it's a way for you to be able to post a question around typically technical assistance issues, but I think this is relevant. So it's a way for them to also gauge and see the impact of what's happening in the communities.
Thanks, Christy. The next question is actually coincides a little bit with the last question, but it's a bit different. It is, do you have a legislative alert, or I guess action alert, or some kind of sign up that local programs can sign up for?
We do. NNEDV has an action alert system, but we aren't on this particular issue. We really do limit our action alerts to sort of like things that you can definitely have a achievable issue resolved, and so like funding and things like that. This is a little bit more amorphous than that, and it takes sort of a high level of understanding. If you aren't a domestic violence program getting this funding, it's very challenging to kind of activate on this issue. So we haven't. So you can sign up for our action alerts on our website under public policy, we would love you to do that and join us on our request for funding and things like that. But on this particular issue, we probably won't at this point be using our system for this specific issue. Congress is on recess, et cetera, et cetera.
Mm-hmm. I just want to add something. This is Larissa. Something that NASH is really, really focused on working with local programs and providing support to local programs, because we came from and we're a project of a local program in the District of Columbia. Something that we're hearing a lot from the field is really a need for a space specifically for local programs, whether they are providing residential services or not, as long as they're doing something connected to housing and homelessness, to really discuss what's happening in their communities and ask questions around different models, how to work, what is coordinated entry, how does How can we work in our community to serve survivors better? Just a range of questions. How do we apply our local housing protections in a way that, you know, our advocates understand them and survivors understand them, just a range of issues. So not specific to a legislative alert at this point, but something that we will most likely be setting up in the next couple of months will be some kind of forum for discussion, whether it's a listserv, and eventually it might be something that includes legislative action. So I just want to put that out there, something to flag for something that we are hearing a lot from the field and that we're going to hopefully be addressing. Okay, let's see, next question. I think that might have been the last question that I have seen. Let's take a moment if any of you have additional questions. If you want to go ahead and put them in the general chat. We still have a couple minutes left for the webinar, so we can still address them.
So, Larissa, one other thing I want to point out, and I don't think we've raised this yet, but, you know, I know some continuums are well in the process of making funding decisions, but there's still the appeal process, so I don't want to rule that out. And so especially if this, DV-specific projects are reaching out through the HUD exchange on the AAQ portal and expressing concern or posing questions about what they need to do. The other piece of it I would say is that there will be, and it's supposed to be coming out I think this week, an in-focus message not only from Anna Leva at HUD, but in conjunction with, is it with USICH or the White House, on the very issue we're talking about today. And so sometimes, because things get lost in all of the guidance and federal regs that come out, but sometimes if you have, especially with Anna Leva, because she's the Deputy Assistant Secretary, with HUD, if you have that information in hand, it kind of, again, gives you another resource and tool to be able to go back and really present the sound information of why DV-specific TH projects need to be included in funding.
Thanks, Christy. And
hey, Joyce, I think Joyce's question, thanks.
Thanks, Monica. Go ahead.
Larissa. I was going to answer Joyce's. Hi, Joyce. So many familiar names and faces. So, yes, we are working on this issue of related to the vulnerability of folks and their ranking individuals. So this is about, I am an individual who presents to the coordinated entry and I need homelessness services. And the way in which folks are ranked for priority, or typically by their vulnerability through different assessment tools, or like a vulnerability index, for instance, doesn't always place domestic violence survivors at the top. And you know, I think that there's, we certainly push back against models that do that, especially models that don't, you know, specifically look at the vulnerability of domestic violence survivors. And one thing that I think is incredibly important is to be at the continuum table and to really voice those concerns. So there's nothing written in the physics of the planet that says that domestic violence can't be in the vulnerability of the Chicago homelessness system, right? There's politics, and there's power, and there's folks that are sitting at the table making the decisions. But like, you know, I think that making the case that other communities have done this work, other communities have said, hey, we think when someone's fleeing, you know, potentially life-threatening violence, that's them higher on the list. And their communities have responded and listened to that, really, about vulnerability. So I think that making the case at your continuum is the best way to do that locally as we sort of work on things at the national level, which we are doing, but it's a slower process than many of us like, but I would say that's the best way to do it at the local level. And Joyce, if you want specific communities that have information about how they've helped prioritize victims of domestic violence, I can certainly do that. In terms of, like, you know, what are HUD understood levels of vulnerability, certainly HUD is looking to, you know, pull folks off the streets or who are in shelters who are chronically homeless and who have a qualifying disability, because that has been a priority of HUD's. And so that, you know, you can't prioritize everything in that is a challenge, but I think somebody up on the list in terms of vulnerability, domestic violence, should be able to do that. And it's about a lot of like individual advocacy. Do others have an answer to that?
I think that covered
I don't
it for me, Monica.
Okay. Yeah.
Looks like we have a question. Actually, this is sort of a pieced together question that I was able to pull that I think is really important, and we've been discussing this internally as well. And the question is, our HUD field office is saying that transitional housing had to be Tier 2. I'm guessing the addition to that is, what can we do? Is that true?
I'm sorry, Larissa, did you say that the perception is the field offices are saying they have to be in Tier 2?
Yes. This specific HUD field office is saying that transitional housing has to be in Tier 2.
So
that's
yeah,
go ahead,
misinformation, right?
Yeah.
And
yeah.
Yeah.
Right. This is Monica. I would agree. Like, I think that, that's, I think if the field office wanted to say that accurately, the field office would have to say, looking at the pressures within the NOFA, we don't see any other way of funding T housing other than placing it in Tier 2. They could say the set of pressures that we're facing and all of those things. They could say that relatively accurately that they feel a pressure to put DV programs, T housing in Tier 2. They are not accurate if they say domestic violence has to be in Tier 2. HUD has not said that. And I would just say, thank you for this piece of information. Can you please point to the place in the NOFA that says that? Just make people work to give you these positions, right? Like, it's not in the 60-page document that's incredibly detailed. It's not there. So you have to push back on your community and say, I don't see that in the NOFA. Show me where you see that. And then they're saying, oh, no, that's right. It's not in the NOFA, but based on X, they give you more information. And once you have more information, you can negotiate from a better position. But that isn't a porky pie, as we would say in England. That's, it's just not, it's not truthful.
And I would also, in anticipation of the in-focus messaging, again, when that comes out, I think that's the thing to have in hand with Anna Leva's signature on it to be able to also do some pushback.
There are also a number of communities who have maintained domestic violence transitional housing in Tier 1 and who will again this time. Any of you who have been guaranteed that you're in Tier 1 yet, please email or let us know via the chat. We'd love to know that. And that's actually another reminder, when you're telling us about your experiences, we hear a lot from folks who are in distress, but it's also good to hear from folks who've been able to navigate this, because we can look to that to really build our case studies, as Anne is talking about in the chat. So please keep in communication with us if you have a good story to tell as well.
Right. And I just want to add to that, it's really disconcerting to hear that that kind of guidance is being provided by the HUD field offices, any of them, or any HUD technical assistance provider, and that's what makes the Domestic Violence and Housing TA Consortium really unique, in that we have direct access to all of these federal partners, including HUD, who's a partner in the consortium. So once you are able to share with us where these specific issues are, which offices are doing this, where are you getting this specific information from, then we can really take some action. And yes, to reiterate, the case studies that both Anne and Monica just mentioned. So you can put this both in the chat, which obviously we have access to and we'll take a closer look at, but also you can contact any one of us and provide even more detailed information if it's not something you feel comfortable sharing in this way. And also contact any of us if you have specific questions, like how do I work with my COC? How can I get this message across? I've seen a lot of questions come through the chat that has to do with that on the local level there's really a disconnect, even if there is a domestic violence presence. And so we can all work with your organization or your community to address that.
So the other thing is if anyone is planning on attending, Loris, I'm about to do a shout out and plug. If anyone's attending the National Alliance to End Homelessness Conference next week, we are hosting a listening session on Wednesday afternoon, and it will be in the agenda, conference agenda, but we would love to have you there to be a part of the conversation because we really are hoping to have a dialogue targeting COCs, but we're really in the leads for those, but we really, it would be helpful to have your input too if you're there. And then also if you are attending Wednesday morning, HUD is hosting a DD policy listening session at 8 o'clock as well, and Anna Leva will be there to host that. So if you're there, it'd be a good time to get one-on-one time with Ann to express concerns and challenges.
Thank you. I have one other piece of advice that's kind of a good note-taking piece, and I will send this out to the state coalitions and others who I have emails for. We just recently learned that there is a slim opportunity for some programs that operate as transitional housing to maybe be reclassified, slightly different than reallocated. In the grants inventory worksheet, that there's still an opportunity to do that for about, 2 days or something. It's not very long. So I'll get that out there, which might help folks. If you're a transitional housing program that really operates like a rapid rehousing program, but are still called transitional, and you aren't interested in reallocating or for whatever reason, you might be able to use this opportunity to sort of amend the, quote, grants inventory worksheet before Friday, to put yourself into that rapid rehousing classification.
Okay, great. Thanks, Monica, for adding that. I am looking to see if there are any other questions. We captured a couple sort of in one shot as well. I'll give everyone another minute or two if your question hasn't been answered or addressed to put it in the general chat.
One of the ways that the domestic violence community has worked to prioritize EV housing in needs assessments is to ask the domestic violence question first, not to say, are you a victim of domestic violence, because people don't really answer that accurately, but is to say, are you in fear at your home, or is safety an issue for you? And then folks can answer that and then be either they can be helped by a domestic violence advocate. So sometimes that helps put folks into the domestic violence housing stock, whether it's shelter, transitional housing, rapid rehousing, or other. That's one way. But in terms of competing for the other funding, other HUD-funded programs like general rapid rehousing or that doesn't really help with that, but is one way for folks to be sure that you're, in the meantime, before we come up with our best suggestions on needs assessments, is that one way to do that is to make sure the domestic violence question is at the top and that it's asked in a trauma-informed way, and that's one way to do it. The other way, and I don't know, Larissa, if you want to speak to this, is to co-locate a domestic violence advocate at the continuum of care to be able to help this person navigate their options and do that safely?
Yes, and actually, and that's something, thanks Monica, that's a model that we have been working on in the District of Columbia. We actually at the District Alliance for Safe Housing, our local program, have co-located staff at the Family Housing Intake Center and have actually worked with some of you who are joining us for this webinar on how to do that in your communities as well, what that looks like. In addition to that, so we can provide technical assistance and support around that if that's something that you're interested in doing. In addition, in terms of our models at the District Alliance for Safe Housing, we can work with you. We have a transitional housing program and also a project that has most of the elements of rapid rehousing project called the Empowerment Project. And we're happy to have sort of in-depth conversations about how your program can do that, what that can look like, what can happen in your community, what you currently have, whether it is, driven by sort of funding sources and opportunities or a general interest for the survivors in your programs and in your communities, that being kind of model that you want to implement. So feel free to contact me directly or to go through our NASH info at -dc.org to get some technical assistance or to send an inquiry around any of those issues. Thanks, Monica.
Yeah, that's an exciting model that we're always happy to promote. I think Anne will probably answer. Yeah, I would answer Joyce's last question about housing options study.
Oh, I see it in the chat box. Okay.
And I have one other question from Sonia.
Go ahead.
Sorry. I'm so sorry. Your question about, does anyone have a separate domestic violence coordinated access system? Yes, in development, a number. I know that Multnomah County in Oregon area does, and so they could talk to you about that. They coordinate all their resources together. And having done so, they feel like it's made them more competitive for additional dollars to do rapid rehousing and other housing supports for survivors. I know that there's development in some communities as well on that issue, but I can't think of anybody who's totally completed it yet, who's ready for prime time. But if we think of anybody, we'll let you know. And then Anne, I think, is going to answer Joyce's question. Yes. So, in addition to Anne's answer in the chat about research studies about domestic violence, transitional housing, I think we have done, I know Anne and Chris have done a good look at what's out there, and many of the studies that are done don't really take into consideration the domestic violence side of things, and so that's one thing. So what we pointed out to our federal partners is that the opening doors, the federal strategic plan to prevent and end homelessness, does in fact say that there should be more information on how to serve specific populations, and there should be more research done on what interventions work best for which populations. And in the absence of that research, the research that the federal government says is important, decisions are being made on research that really doesn't include the perspective of domestic violence. So we've made that point to our federal partners, and I think it's resonated, and we hope to be able to do additional work to get some information that will help make our case in these forums and others.
All right, so should we do some final thoughts as we wrap up? Monica, it sounds like you started your final thoughts there. Do you want to add anything else? Christy?
Sure. Yeah, I'll if anyone else wants to go first, I'm happy to.
No, you can keep going, Monica. You got this.
All right. All right, thanks. So, yeah, the chat has been incredibly informative for us, and we hope it has been for you as well. We're here if you need any additional information. Again, remind your communities to get on that webinar for tomorrow. Tell us about your experiences, complete the needs assessment when it comes across, if you're at the National Alliance's conference next week, come and see us. And I think that's it from me.
Christy, do you want to add anything?
I would just say this has been very helpful, the information y'all have provided today. Again, it's helping us to be able to quantify and really being armed with all of the information to develop the strategies that need to happen. So we certainly want to continue to hear from you. And I know a lot of times we focus more on the challenges, and especially right now because it feels very much like crunch time. But we, again, to reiterate what my teammates have already said, we're also interested in hearing where things are happening around emerging practices as well, because I think it's important to share that information out so we all can figure out how to do it and do it right. Thanks, y'all.
Thanks, Christy. Just one final piece. Once we do get the Safe Housing Needs Assessment out to the field, which hopefully will be in the next couple of months, we will be sharing best practices that are happening around the country, and also it'll be a direct access to technical assistance and training if you're interested in it. So that's another route to be able to get it from our consortium team. I also want to thank everyone for their honesty. This has been a very informative webinar, and I want to say a big thank you to Anne, who, although we did not have her on audio, has been doing an amazing job here in the chat, fielding questions and giving timely responses. So again, like everyone said, please do not hesitate to contact us, call us, or email us. We all communicate with each other regularly, and so you don't have to contact all of us in one shot. You can contact any of us if you'd like to, and we will communicate with each other and then get back to you too.
Wonderful. Thank you, everybody. We'll be in touch. Take care.
Thanks, all.
The leader has disconnected. The conference will be terminated in 5 minutes. The leader has turned lecture off and your lines have been unmuted.